I guess after having an understanding about health literacy and a health literate organisation, we had two slightly different approaches, one for the staff and one for patients and whānau. While we could talk to staff about the health literacy directly with patients and whānau, we were mindful that it wasn't to be a patient deficit model, so do you understand wasn't what we wanted to ask, so putting it into context, getting an understanding of what they knew, and then I guess the teach back, getting them to give us the information back was far more appropriate.
The questions we found useful were not asking them what they understood about what had happened, but more indirect questions such as what would you tell your partner as to what happened and the outcome of this consultation, or what would you tell your employer? And that provided a conversation where the family member was able to put into their own words their understanding of the conversations that had been said and what was going to be the next steps as a consequence of that consultation.
So when interviewing service providers, it's helpful to know what role each of them has in terms of helping the patient along their journey, how they help the patient understand what has happened to them so far, and what's going to be happening in that encounter, and then what the next steps are after that. And there are some questions in the guide that can be useful in helping explore that with people.
Listen to the story. Ask them to explain their journey, explain how it started and what happened, rather than direct questions, because you get a richness from a story that you will not get from direct answers. You'll often get a yes or a no from a question, although it could be an open-ended question, they will see a yes-no answer. Whereas if you allow them to tell you a story, it's so rich, it's so valuable, and it has an awful lot of personal meaning behind it, which is really helpful. You can hear where the good learning has happened, where the understanding from a health literacy perspective has been good. Has it come from a healthcare professional, or has it come from a friend, or has it come from the newspaper or media? And it really tells you a multitude of different things listening to the story.